All right, I am going to give it just a minute so that we can have some of those who did RSVP hop on, and I am going to toggle back and forth from my streaming website and YouTube. So if there are questions, be sure to put them in that comment box, and I will be checking both throughout the whole webinar. Hello, everyone. I'm just going to give everyone else who RSVP'd just a chance to hop on before I start speaking. There is a comment or question section, and everyone is welcome to throw any questions or comments or concerns in that box. I will be checking both my website and YouTube throughout the webinar just so that I make sure I don't miss anything. And if I do, I will for sure catch you at the end. Okay, I am going to go ahead and get started since we are limited on time. So I am Alicia, esthetician at TrueBody, and today we are going to be talking about the stimulator peel. So the stimulator peel is from ZO, which is a medical grade skincare brand, and here at TrueBody we call it the True Refresh. This is a light peel that is going to be a treatment facial here at the spa, and we're going to kind of go over what would require or what's an indication for you to get this chemical peel and what it does in your skin so that you're prepared for when you do come in for your service. So, what's an indication for treatment? That is a skin condition that would cause you to want to get this service done. So, first and foremost, dry and dull skin. Everyone in Wyoming has dry or dull skin. Everyone coming out of winter has said this. I can't even tell you how many times they walk in the door And so this is going to help slough off that surface level texture and help us break through to some fresh skin. So textured skin, acne prone skin, or pigmentation of the skin, which kind of go hand in hand sometimes. And this is also really great treatment for someone who's new to peels or is looking to start treating their skin, but isn't quite ready for something like a medium depth peel where you will have peeling for potentially 5 to 10 days. So, what is stimulator peel? Adjacent, I have a list of the core ingredients that go into the stimulator peel itself. We're going to break them down. First and primary ingredient is lactic acid. Lactic acid is a alpha hydroxy acid, which is an AHA peel. This is going to be the primary molecular size of the entire. So we're going to be working with AHAs today. Gently exfoliate. It's going to draw deeper into the skin, and it's very brightening. Citric acid. Everyone knows citric acid. Everyone just doesn't know that it's in skincare. So there is a very typical citric acid that most people are using, whether it's over the counter or medical grade, and that's vitamin C. Vitamin C is great. It's a super antioxidant. It's going to help brighten the skin. It does help exfoliate. It is acidic, and it's also going to help adjust the pH of your skin so that the peel can penetrate effectively. The next acid included in the stimulator peel is another AHA. It's glycolic acid. This is a little bit of a small size, so it's going to get deeper than what the first two ingredients are. And it's also going to help break down congestion or bacteria in the skin. It's going to stimulate collagen and elastin, which most of these ingredients do because we're stimulating the skin itself. It's going to help improve texture through exfoliation, and it's also going to help boost skin cell turnover because we are manually exfoliating the skin at that moment. These are going to be a base of primarily all of the peels that you will get in either a medical spa setting or through an esthetician like myself outside of a spa setting. Okay, the next ingredient is a mouthful. This is diglycosyl gallic acid. This is a molecule activated by the skin's microbacteria. So this is a chemical that we created. It is going to be the most effective in brightening the skin. So I want to talk about why skin needs brightening. There are two types of pigmentation that we see commonly in the spa or in skin, and it's going to be PIH and PIE. And they come from different problems, but they also can be treated differently as well. But this ingredient is going to treat both of them. So PIH is post-inflammatory hyperpigmentation. This can come up from sun damage, from an injury, or from acne. And PIE is primarily from an injury or inflammation like acne or a laceration. PIH is typically brown or darker tan in color, and PIE is sometimes red or purple or even pink in color. So this skin brightener is specifically targeting those pigmentation spots. Whether they are old or new, whether you are young or old, this will be a great ingredient to include in a peel because it's gentle enough to use weekly without stripping the skin like something hydroquinone or even a deeper medium depth or deep depth peel would. So it's also anti-inflammatory, it's an antioxidant, and it's triggered by the microbiome of your skin. So I can't overdo it on your skin unless there's too much going into the skin because the microbiome is allowing me to. So we have this term in both aesthetics and the medical spa setting called frosting. Frosting can happen during peels, and it's essentially your skin barrier letting me know that I have done too much and that it cannot absorb any more product. And it just looks like frost on the skin. So if I were to see that, that would mean we have done as many passes as we could, that your skin has absorbed everything it's capable of, and we're done with the totally safe. It's something we look for as we're doing the peel process, but this is kind of where that ingredient comes into play. Okay, beta-glucan is a polysaccharide. So it's found in oats and mushrooms, which it is very specific because it is anti-inflammatory. So this is going to soothe the skin, help repair your skin barrier, which is super important when we're looking into summer heat or especially dry winter seasons. Your skin barrier doesn't have enough moisture to maintain itself. So this is going to help soothe that skin barrier so that your skin is healthy and glowing and it's strong enough to tolerate sun exposure or injury like UV radiation. Okay, the next ingredient is quite frankly a mouthful, and I'm not even going to attempt to say it. It is Szechuan pepper fruit extract in lemon straws. So people kind of get a little curious when we talk about extracts in our peels or some of our serums or treatments. So it's actually very common to use products like arrowroot extract or Sichuan pepper extract because these are natural derivatives that are going to help stimulate the skin. So this is going to help give that peel the tingle that you feel when we're applying to let us know that it's working. It's also going to help improve your skin's tolerability. So over time, you can become tolerant to products. And if we were to overdo it with this peel and you might not feel the effects like we used to, that's kind of our sign to signal to increase in depth or increase into maybe an AHA BHA peel or something a little bit more potent like a TCA peel. Um, this is mostly for us to communicate, but it's also great to signal that the peel is working as I'm putting it on your skin. Okay, so what does the peel process look like? There are some consent forms when you come in. Mostly, we want to know if you're on retinol products, if you're on skin brightening agents like hydroquinone or a brightening serum or vitamin C, because there are active ingredients in the peel itself. We don't want to mix anything to cause a reaction. And when on products like retinol or hydroquinone, your skin cells are already turning over faster. The point of a retinol is to speed up that skin cell turnover so your skin is staying fresh and is less prone to damage. So while on that, you are more susceptible to a bigger anticipated reaction because the peel is being put onto more fresh skin. You're using at home and what we can use post treatment. We take you back. You will get a double cleanse. We have a plethora of cleansers that we like to use here at the spa. They range from dental cleansers, hydrating cleansers, makeup removers, whatever we need to do to get the skin clean and the base prepped for the rest of the facial. So, depending on how congested the skin is, after we cleanse, we sometimes exfoliate. Exfoliating pre-chemical peel can sound a little intimidating, but this is going to prime the skin. So if someone is new to facials or maybe has a little bit more severe damage to the skin, we're going to use this to prep the skin so that the peel is effectively penetrating the skin rather than staying on that surface level, it's called the stratum corneum, just so that we're giving you the most effective treatment we can. We then remove the exfoliating process and we're going to prep the skin. So the peel prep is actually such an important step in the peel process. Prepping is not always the most fun because it can smell almost like alcohol or acetone. And those of you who have had them before might notice it can be kind of drying on the skin. This is intentional. So a peel prep is not only going to degrease the skin, it's going to pick up any product that I missed while cleansing or exfoliating the skin and removing those things, but it's also going to bring the skin to the correct pH so that the peel itself can penetrate to the correct level. So naturally, our skin sits at about a 4.5 to 5.5 pH. When we use the peel prep, we're actually lowering the pH, which is going to bring it down to like a 3.54, so that the peel itself is going to work through those dead layers of skin. So I have some notes here. It's going to bring it down to about a 3.5 to a 4, so it's not much different, but it can feel tight and dry. That's because it's absorbing all of that oil or sebum that has been produced in the skin post exfoliation. It's also going to help break down the bonds between the dead skin cells. And this is super important because we want the peel to break through the skin cells and remove them, exfoliate them, rather than just treating what's already there. We're doing a peel because we want to hyper exfoliate. That's the point of a chemical peel. That's actually what a chemical peel is. And I think the term chemical peel can get a little intimidating, but in really, it's just us exfoliating in a controlled environment in the office. So by using the prep to help break down those dry skin bonds, before the peel process, it's actually going to allow us to remove more of that dry skin in a safe manner. We don't want to over exfoliate the skin by using a scrub or a polish or even an abrasive rag. In this environment, this peel can only stimulate the skin so far. So it's very controlled, and this is going to prep the skin for the peel itself. So once the prep has dried, we will then begin to apply the peel. So next, I have a diagram of what the skin layers look like. Because when we talk about a chemical peel, it's sometimes hard to imagine what's actually going on in our skin. So as you can see, the epidermis, the dermis, and the hypodermis is what we're looking at. Light peels will always stay in the epidermis. The ZO stimulator peel, or the true refresh, is a light peel. So we will not go past the epidermis. And in fact, this is so light, we're going to stay in the top 3 or 4 layers of the epidermis. And as you can see, they're all labeled above. The stratum corneum is what I mentioned earlier. This is primarily where all of your texture lays. So if you are a woman and you put makeup on and you notice that there's some pilling or maybe your foundation doesn't sit right, this is typically why. Sometimes it can be because your products are mixed incorrectly, but this also is because the stratum corneum needs exfoliated, and it's just the dry skin. It's what's actually there to protect the skin, but if we don't exfoliate it often, our skin barrier isn't healthy. And so we need to kind of have a healthy balance of both exfoliation and hydration in order to maintain a healthy skin barrier. So once the peel is applied, we wait about 1 or 2 minutes. You'll feel a tingle, and we kind of wait for that to dissipate. But once it has, we do a second pass. This time we're going to use a little bit more pressure. This is going to make sure that we're really targeting that third and fourth layer of the stratum lucidum or the granulosum, so that we're treating where the pigmentation lies. So in the diagram, it's a little funky to look at, but there's all sorts of, I guess, inclusions in this. There's some blue and red. Those are vascular regions. There are some funny looking hair follicles sticking into the skin. And then there are also some swirly little tubes that almost look like intestines, which is crazy. These are actually where sebum is produced. So this is going to penetrate those top layers of those tubes to help control the oil. It's going to refresh the skin, it's going to exfoliate the skin, and we're going to be treating any pigmentation. Pigmentation starts on the surface, and depending on how well you take care of your skin, it will go deeper. And so if we can stop it before it's too deep, it's a lot easier to treat than it is to correct. And so that kind of leads to neutralizing the peel. When we neutralize, there's this chemical reaction that happens that kind of feels funny. It feels a little bubbly, but it also can feel spicy again. That's totally normal. We're bringing your skin back to that normal pH of about 4.5 to 5.5. So the purpose of this is to prep the skin for the finishing products. If you're an acne patient, we will be using tools or our hands or Q-tips, sterile instruments to do extractions at this point. And we'll also be using this time to kind of assess what the skin looks like. Redness, flushing, and a little bit of irritation is totally normal. Again, this is a light chemical peel, so we're staying on the very surface of the skin, not to interrupt anything going on in the dermis or even the deep epidermis. So this will typically subside within a few hours, if not overnight. We then will apply post-treatment products. This can include a face mask if we so decide that your skin needs it. We have a plethora of moisturizers, and you always end with SPF. SPF is so important. You need to start thinking as SPF as your skin's first line of defense in maintaining what you have. So everyone's worried about the wrinkles or spots or aging, but what we don't realize if we don't start doing something about it daily, it's just going to keep getting worse. And SPF is one of those things. You need to wear it inside. You need to wear it outside. You need to wear it when it's rainy, just every day. It's so important. And so we'll apply an SPF and set it on your way. Typically, we have patients do this on their lunch, which sounds so crazy, but it's so minimally invasive that we don't typically have big reactions. So they're able to apply a tinted sunscreen or maybe some powder and head back to work. That being said, if you are a first-time peel patient or you have not gotten a skincare routine settled at home, you could have some minimal peeling. That is totally normal. It's not unexpected. However, it doesn't last long. So once we've applied the post-treatment products, you're pretty much good to go. There is not much else to the True Refresh itself. This is a service that you can do weekly until you obtain desired results, or we can do it as a maintenance. So I have chemical peel patients who come in throughout the winter and fall to get their skin, whether it's pigmentation or scarring or texture, we kind of reset it during winter and we use and abuse our skin. It's dry out, it's hot, we tan, we're in the sun. During the summer, we don't often do those deep depth or medium depth services if you cannot abstain from being in the sun. So this is a great way to not only maintain results, but treat the skin safely while you're still enjoying summer. So let's conclude here. The Zeo Stimulator Peel is a gentle yet effective chemical exfoliation treatment designed to refresh and renew the skin with minimal, if any, downtime. I personally do this peel and I have no downtime. However, everybody's skin is different, and your skin barrier is going to be a very important factor in how your skin reacts. So, we always love to get patients on a nice skincare routine to make sure your skin barrier is strong before we start treating, whether we're using a chemical peel, microneedling, or lasers, because this is going to give you the best success with any of your treatments. So we follow the peel with medical grade skincare post-procedure to enhance skin health while treating texture, pigmentation, oil production, and more. Again, this peel is safe for all ages, and it's safe to even do weekly while you're trying to either maintain or obtain results without doing anything too invasive like that medium depth peel. I haven't logged back onto YouTube, so I'm gonna just hop on here and see if there are any chats. And I'm not seeing too much right now. So if you guys have any questions or concerns for now, I'm going to hop back over so I can talk to you about why you should get this done. It's super quick, to be honest. We're gonna see you and get you out in about 45 minutes. We'll go over all post-treatment protocol with you, and we also will be sending you with some fun products to try. We really don't like when anyone is empty-handed, and you're here for a reason. And so we want to treat the skin, and we also want to protect your skin. So whether you get an SPF sample or a new moisturizer sample, we are giving this to you because we feel like this is what's going to help you skin health. And now let's talk about the fun part, why most of you guys stay to the end, what you get out of this. So you, by showing up to the webinar, have 24 hours, you will get 15% off your facial when you book the True Refresh. So the original cost is $150, and you're actually going to save a lot more than $25 because during this peel, I'm going to add medical grade red light onto the surface so that you are not only going to stimulate collagen and elastin on a deeper level, but we're also going to knock out the skin with another anti-inflammatory service because red light is so great and it's such an applicable treatment for everyone during the summer. If you have it, we might as well use it. So the red light will be included with all facials. And if you are a VIP, your VIP membership takes precedent. So you can't stack them, but you'll get the 15% at least for watching the video, or you'll get the 20% or whatever VIP membership discount takes place if it's above. And VIP members will also get a free product at the time of service. We'll kind of discuss what's applicable according to your skin type, your skin tone, and your skin concerns. So everyone might be a little different. But I wanted to take this time to go over what the VIP is, because if you're here getting a facial done every month, this will pay for it in itself, and it will help us maintain your skin results while we're doing so. So we have 3 tiers. We have the gold, the diamond, and the emerald. The gold is $175, and your discount is 10% off all services and products. This is including being seen by me or Betsy, our PA for functional medicine. And if you're doing both, you're really missing out on some big discounts by not being a VIP. They increase, and with VIP perks, you get first come to any new services, any new products. You get surprise gifts. Sometimes we might host a party for VIPs. And then it kind of goes on while you're receiving treatment during the summer and year round. We like to reward our patients. So we now have a loyalty program. For every dollar you spend on services, you earn 2 points. And for every dollar you spend on products, which will be either your pre-treatment care or your post-treatment care, you will earn 1 point. And those points equivalent to dollars. So 100 points equals $5, and that can be used back onto services and products. So that being said, I think I've pretty much gone over everything I can with the stimulator peel. I'm going to hop back on one more time to make sure I do not have any more questions or concerns. But I think that's pretty much all from me. So I am so excited to see you guys in, and we will get to treating your skin this summer. Thanks.